Medicines to treat multiple sclerosis are insanely expensive. So how are you supposed to get them if you don't have adequate resources or insurance? That's what we're going to talk about in this video. Don't turn away because all of that starts right now. Howdy! Thanks for learning about MS with me, Boster. As a multiple sclerosis neurologist, I spend a tremendous amount of time in clinic helping people impacted by MS gain access to these super expensive MS medicines. Over the last decade and a half, my team have come up with tricks and tips to help people who are uninsured or underinsured get on disease-modifying therapies. So if you or a loved one are looking for ways to gain access to these medicines and maybe don't have adequate insurance, don't turn away because that's what we're going to be discussing. So let's jump in. Number one, manufacturer patient assistance programs. Each drug manufacturer has a patient assistance program for someone that has no insurance or someone that has very minimal insurance. And if you qualify, oftentimes they will provide either what's called copay assistance, where they help you pay your portion, or a literal free drug program. If you'd like to explore this, talk to the manufacturer directly. You can literally call them, or you can talk to your MS provider because they will understand the process to apply for this. You also could reach out to one of the MS advocacy organizations. Any of these groups can help you with the process of accessing copay assistance and free drug programs. Number two is to apply for government assistance programs. If you are underinsured or uninsured, you may qualify in the United States for either Medicare or Medicaid. These government insurance programs do have MS drugs on their formulary and will help you gain access to these medicines. Number three is for American veterans. You may be service connected and be able to receive some of your medical care through the Veterans Administration or VA healthcare system here in the US. Many of the patients that I care for are service connected and have access to the MS disease modifying therapies through the VA hospitals, and they don't pay for those meds. Hey, real quick, if you like this video, do me a favor and give it a thumbs up. Also, if you haven't yet subscribed to the channel, please consider doing so. Those two actions teach the YouTube algorithm that you really like this content and help push it out so more families impacted by MS can benefit. Thank you. Number four is to apply for grant funding. It turns out that there are organizations such as NORD or National Multiple Sclerosis Society that have a pool of money each year that they use to help patients pay down copays. If you can find them on the interwebs and apply, oftentimes you can land a grant and it will help you for that year. Definitely worth looking into. Number five is to talk to your provider. There are some things that we can sometimes do in the clinic to really help in this situation. Number one, some providers will literally have free samples. And so we can start a patient on a free sample of an MS DMT, sometimes getting them 1, 2, or 3 months for free, which really gets things started. The second thing we can do is sometimes be creative with off-label and generic medicines. As a quick example, there's an off-label, generic, and very inexpensive rheumatoid arthritis medicine called Arava, and you can get it with certain coupons for as cheap as $1 a day. Well, Arava, the first metabolite once you swallow it, is Aubagio. And so we can use an off-label generic sometimes to provide access to a drug when otherwise we couldn't get it through insurance. Number six is for patients who have multiple sclerosis and they also have another autoimmune condition. This happens more than you might think. In certain cases, we can get a drug approved for the other autoimmune condition that we know will work to treat MS. For example, we might be able to use a B-cell depleting agent like rituximab, or we might be able to use IVIG for a different autoimmune condition that will do double duty in MS. Number seven is to consider participation in an MS clinical trial. If you participate in an MS clinical trial, you will gain access to an MS doctor, an MS nurse, laboratories, MRIs, and MS medicine for free. If you enter a phase 2 clinical trial, oftentimes it's an MS therapy that they're studying, like an investigational medicine, against a placebo or dummy drug. Now, I don't like that, but In a phase 2 trial, it's typically only 3 months where you're either on real drug or placebo, only 3 months. After 3 months, everyone is put on the real drug, oftentimes for years and years. And for some patients, taking that risk of being on a placebo for 3 months to then gain access to the medicine for years to come is a worthwhile trade-off. If you participate in a phase 3 clinical trial in MS, those are not with placebo. So every single person on the trial, in addition to getting free doctor visits and free nursing and free labs and free MRIs, they get a free MS medicine, and it's either an investigational medicine that we're studying or a real MS medicine standard of care, no placebo. These trials go on for 2 to 3 years, and then patients are offered an opportunity to go into an extension arm where everyone gets free drug for years to come. Again, for the right patient, this can be an awesome option to have your MS treated, even if you don't have adequate insurance coverage. If you'd like to learn more about MS and up your game, click the video that's on your screen right now. And until my next Monday morning video or my next live stream, or even better yet, the next time I see you at the Boster Center for MS, this is Aaron Boster saying be safe and take care.